Hello and welcome to episode 9 of the Dental Realist Podcast. I'm Dr. Ryder Waldron, and we really appreciate you tuning in with us tonight. We're excited about this episode, and in a few minutes we're going to get into our main topic. And a little bit later we're going to talk about a giveaway we're going to do with one of our books, a copy of one of our books, and then also let you know about some exciting practice opportunities that we're aware of if you happen to be looking for a job. But before we get to any of that, I want to introduce my friends and co-hosts, Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going today?
Yeah, it's doing good. It's great to be here.
Good.
I'm excited about talking about the topic tonight.
Yeah, we're excited to have you. Thanks for showing up.
Hey, I'm always here. So if you ever need, just give me a call.
Marcus, how about you? You may be curled up in the fetal position sucking your thumb after a long week of dentistry, but how are you hanging in there tonight?
Yes, I'm I'm here. I'm ready to roll. I've got my golden voice ready to.
Yes, it's that award-winning voice.
Tom Lauer voice right there, coming to you live, everybody.
I mean, if you didn't know he won an award, you'd want to give him one for his voice. So.
Right.
Anyway, so our topic tonight, we're going to discuss patience, the importance of patience, and how to manage some patients, and we're going to come at it from a little different angle than you would probably normally hear, because as you know, on this podcast, we like to keep it real honest. We like to give you real information. We are real dentists, so we are, in the same situation as many of you. And so we're just really excited to be able to talk about this. And as we get into this, Troy, this might sound kind of stupid, the way I'm going to phrase this, Troy, but can you tell everybody what the importance of patience in a dental practice is?
Yes, absolutely. Patients are absolutely the most crucial thing that exists in a dental office. Because if they aren't any patients, we don't exist. That's the reality of it. And it's a very unique nature, and that's kind of why it's interesting what we're going to be talking about today, because, of course, people have probably already been on the internet, and, people who are listening who are dental students, who are, new dentists, veteran dentists, whatever, have one take on patients and will understand a certain part of it. And then, of course, we have to be considerate to our patients, because if they walk out the door, of course, we don't have a practice anymore. So there's a lot of weird dynamic that goes into patients with, in the dental office. Because if we don't have any, we're not going to be in business. There's no need to have a dentist.
Yeah, that's the definite truth. Yeah, and it is a strange dynamic. It's a really unique relationship that we have. And Marcus, why don't you tell us what your idea of an ideal patient is? Because to me, they're almost like Sasquatch. You hear about them, but you never see them. So if you can kind of give us a breakdown of what the ideal patient would look like, and then we'll kind of carry the conversation from there after that.
Yes. I've had a few here and there that I thought were maybe ideal patients, and so I'll give you maybe a little bit of a description of what they were like. So basically, when they came to the office, they showed up to their appointment on time. When we did an exam and I diagnosed stuff, they pretty much agreed with what I said. They didn't argue or try to question what I was diagnosing. They just agreed with what I was diagnosing. When it came time to schedule the appointments, they scheduled the appointments. They went ahead with our payment arrangements. They didn't try to make their own unique payment arrangement or no payment arrangement at all. When they came to the appointment for the treatment, they paid. They came back. They were real cooperative. Get them numb. They got numb real easy. You went through the procedure with no real hiccups because the patient could open wide. And when it was all done, they were happy. They thanked me, and they left.
Give you a hug.
Yeah, might have even patted me on the butt. I don't know.
Yeah, right.
Yes. I mean,
and game pat.
In all honesty, there might have been one, and I can't even tell you who that was. So there probably really wasn't one. I just am dreaming this whole thing up. But that's kind of the ideal patient.
Yeah, I think that makes perfect sense. Troy, do you have anything to add as far as your ideal patient would go?
No, I think Marcus hit it really well, and I think it's very important to note that, the ideal patient in dentistry, I don't know if they exist. I haven't seen very many. If I've seen any, I can't even remember. Yes.
Yeah.
There's always some challenge. Of course, we deal with biological systems. We understand that people are individual and unique, and that what we do is sometimes not comfortable. I mean, we understand that, but there's always something when you're dealing with people that, especially in the dental setting, that makes it to where you're steering very much clear from ideal.
Yeah, and they might say there's no such thing as the ideal dentist either, which we would probably all agree with that.
Yeah. Fair enough.
Yeah, most people don't want to be at the dentist office, it seems like. Sometimes even we don't want to be at the dentist office. But Troy, what are some unique challenges that we do face in this unique dentist-patient relationship that you've learned?
Yeah, I mean, it's a challenging one, and something that I didn't really realize extremely well when I was in dental school. It seemed like some of the patients that I dealt with in dental school were, they were paying a less fee, and they seemed to be a little bit more like realizing, stuff takes forever. But, we have to deal with the situation where, some people can't lay back all the way. Some people can't open very wide. Some people have huge tongues, huge cheeks. Some people don't get numb very easy. Generally, before we start any procedure, they tell you how much they hate you. And how they to not take that personally, but they hate you. And then they open wide or open, and they let you, get in there and you drill on them. Very strange dynamic, because you're sitting there kind of going, where do I stand with this person that, doesn't really like what I'm doing? We always tell people stuff they don't want to hear, they don't want to pay for, they don't want to do. I mean, it is a very challenging situation there to have a real positive outcome when we're stressed, because if a patient can't, like Marcus just gave the ideal patient thing, if you're not an ideal patient, you can't open well and all that stuff, it makes it extremely difficult for us to work in our little tiny confined environment and working in millimeters in a dark hole with saliva and tongues and cheeks and things going on, and to get a perfect outcome. So it's like this weird dynamic of a clash, like, dentists struggling to get perfect work done in an imperfect environment that, you just kind of basically meet in the middle somewhere and hopefully cross your fingers it all will work out.
Yeah, and I think you pretty much described like my entire work week this week, because I had a patient that, he couldn't lay back all the way. He was elderly, and that's fine, and that's totally understandable. And we don't get that many of those, but yeah, I had one of those. I also had a patient that couldn't get numb. And that, what are you going to do? Refer him to the anesthesiologist specialist? Well, that's supposed to be us. So that's tough when you can't get somebody numb like that. And I think you totally nailed it it is a little bit easier in dental school, because you can always fall back on the dentist that's on the clinic floor or something like that. You don't have to deliver all of the bad news yourself. So that's kind of nice in dental school. But Marcus, what about you? What kind of challenges have you noticed in your relationship with your patients?
I think the biggest thing for me is that we're human beings. We are and they are. And with that comes all these unique variables that every human being has, ourselves included. In dental school, at least for the first couple of years, you pretty much are just working on plastic teeth. And so you can get to where you're fairly comfortable with some of the little steps that you do to work on a tooth. But then when you start working with another human being, they have weird quirks, they have weird expectations, they don't cooperate, they don't follow instructions, they maybe aren't the most charismatic person. And so that's a big challenge when you have to act really professional, like you've got it all together, that nothing phases you, that you're just happy as can be, when in reality inside you've got all these emotions too, and you may not really care for that person that's sitting in the chair, or the way that they're reacting to the things you're doing, or the way that they're talking to you, and yet you still have to, because you need them as a patient and you need to complete a procedure, you still have to just act like everything's fine. And to me, that's one of the hardest things to do, is to just contain my emotions and act like everything's just great.
Yeah, and I think you nailed it by saying that we're human beings and so are they. But like in dental school, I just thought that people showed up for their appointments, they got the work done, didn't complain, and they loved us and gave us a hug on the way out even. And it's not quite like that. And there are several patients that are appreciative and really nice about things, and for the most part they're great. But you do get that one bad one every once in a while, and it can really, really ruin your day, I think. And it's
it definitely does.
And I think, you guys correct me if I'm wrong, but I think it's important as dentists that we can think on our feet. We're presented with a problem and we need to think and know how to solve this problem, because coaching, consulting, we've all had it. We've all done it for years, and it teaches you how to deal with these ideal patients. But what do you do if they're not ideal? So I don't know. Is that kind of what you guys have thought, that you have to really be ready to kind of, I don't know, put fires out all over?
Yeah, it feels like you're constantly doing that. I always feel like I'm walking on thin ice, and I guess rightly so. I had a patient one time that looked me in the eye and she just says, "Look, if you do anything that makes me mad, I'm going to walk." And that kind of made me think, okay, she's right. I mean, she is, because she is the patient and she pays me to provide her a dental service. And so I have to meet her needs, or else she will, she has options. She can go to another dentist. On my end, like we started the podcast out with, we have to have these patients to have a practice. So the less amount of people that you can upset, or the more people that you can actually get along with and do like Marcus says, kind of just smile, yeah, good, you're great, sit down, and the more people you can do that with, the better off you're going to be, because you'll have more patients that will stick with you, right? But in the end, the patient is the person paying the bills. They are the one doing, we're providing the service to, and so we're stuck in this very strange dynamic. Yeah,
and patients are in limited quantities. I mean, it's not like they're in most places where everybody practices. It's not like there's just an unlimited supply of patients that have to come to you. So for most of us in most of the places we practice, we've got to really go out of our way to try to show great customer service and be real tolerant and real patient with everybody that comes in.
Yeah, you're right. That's a good point to bring up too, is that, it's not like there's a million people out there looking for dentists. I mean, there are some that don't go to practices, but they're not going to go to a dentist unless they have a toothache anyway. It's those people that do come on the regular basis that you want to capture, because they're people that, usually will take care of themselves and do things like that. So it's a challenge, especially when you have, 50, 60, 70 dentists in a mile radius of your office.
Yeah.
Which is probably not unrealistic in some parts of the country.
It's true.
I mean, when I got out of dental school, I was looking at one practice in a city that actually had 45 competing dentists in a half-mile radius.
Oh my word!
Cool.
So I mean, I'm not in that. I'm not there now. I mean, I'm in kind of rural area now, but that's the thing is, though, they do have options. Even in my rural community, there's 3 or 4 dental offices here. And if you don't take care of them, then they will go somewhere else.
Yeah, and it's hard, because sometimes there are patients that you want to dismiss because they don't follow your office policies. They don't pay their bills. Sometimes they're just rude to you. And I remember in dental school, I had a patient that I was making a partial for, and one of the prosthodontists pulled me aside and said, "When you're in private practice, this is a patient you're going to want to dismiss from your office." He said, "You can't do it here from school because they're assigned to you, whatever. But when you get into private practice, you want to not have patients like this because they're just not worth the headaches." And I also heard one dentist tell us that when he would have somebody coming in that was on his schedule that he didn't like, his staff would not write it on the schedule. They would just say, there's somebody there, but we're not going to tell you. And he'd say, "I just know that, I don't like, it's a patient I'm having a hard time with." And so they wouldn't put it on the schedule. I think, man, if that was me, I would be sweating bullets wanting to know who is that patient.
Yeah, which one is it?
Yeah. What's behind door number 2?
Yeah. Well, let's make a deal, Monty Hall.
Yeah. You have a good point there, though, Ryder. Though that's one thing maybe we can bring up. You really don't want to treat everybody. I mean, I've had patients that I just basically have said, hey, we're going to have to agree to disagree, and you're going to have to go somewhere else. It doesn't happen very often, but I have done that. Someone who doesn't follow your treatment recommendations, and it puts me in a position where my license is involved. If they come back and say, you never told me this or something, and I could be held accountable for that, and I've had to let people go for that.
Yeah. I think you don't want to become so desperate financially that you just feel like you have to put up with anything and everybody and do everything that everybody ever wants. Because at some point your own sanity and your own peace of mind has to be a big important part of things.
Yeah, that's a good point. Well, I always think like if if I see a tooth that needs a root canal and I can't do that root canal, I send them to the specialist. I get those cases and send them to a different office because I don't feel competent or educated enough or whatever to treat them. Well, if I can't treat this person's personality and can't mesh with them, well, then they need to go to a different office also, and it's not going to be my office. So yeah, you're right, Marcus. That's
very true.
Important to keep your own sanity. So
yeah, it's important. I think in one of our books, actually, we talked about that is don't let the patient dictate treatment as far as, or not dictate treatment, but to not allow them to make you do something you don't feel comfortable doing.
Yeah.
Like, say, for example, you can do that implant here. Well, I've never really done an implant, so, okay, I'll try it, I mean, that's just going to go bad. That's just going to go bad. I mean, I had a situation one time and I felt bad for the lady. She didn't, want to travel or go to the specialist, and so I opened up a molar that I knew I couldn't find all the canals in, and I ended up perforating the thing, and ended up having to send her to the specialist anyway. So I'm like, listen, I should have just listened to my gut and said, look, I'm not going to do this. You need to go to the specialist and not have caved in and let her dictate that, what I do.
Yeah.
Yeah, that's a great point because we always get, read newsletters and magazines, things like that, don't let the patient, kind of coerce you into doing treatment. You know what you can do and you know what you're confident doing and you know what you can't do. But patients, for some reason, they do hate going to a specialist office a lot of time. If they need a root canal and you have to reschedule and come back to your office, they are okay with that. But if you have to schedule them to go to a specialist office, for some reason that is inconvenient for them. But, how do you guys handle that? Let's talk about that right now. If they do have to go to a specialist office and they don't want to go to a specialist office, or they ask why they need to go to a specialist office and you can't do it, how do you handle that? Marcus, how do you handle that when that comes up?
It's tough. I mean, I don't know that I do this every time, but I try to just first kind of acknowledge that, I appreciate you asking me to do that. I realize you're comfortable here and we're glad that you're comfortable being here in our office. And then I try to transition into, kind of however, if this was my mom sitting in the chair, I would still send her to the specialist, using the relative or sister, mom, brother type thing, and just saying, if this was my family member, I would have them go to the specialist for this treatment because that's where they're going to get the best care and, something along those lines. And not that always works perfectly, but it seems to at least kind of put a little different perspective on it for the patient, that you're not just farming them out for whatever reason. You're really doing it because it's in their best interest.
Yeah, and that's true because if you were going to do that root canal that you didn't feel comfortable doing, well, you'd get paid for it, but you're actually sending them somewhere else, sending money out your door just in their best interest. So that's great. Troy, what about you?
Exactly.
What kind of...
Yeah, I use a little analogy, kind of like, a general practice physician, I don't want my general practice doctor taking out my gallbladder, And sometimes certain dental procedures require a little bit more specialty care. And, sometimes, those third molars are gnarly and they need a surgeon to take those out, not a general dentist, So that's kind of where I go with that is like, this is just a little more specialized. And I even will come to the point where say, I'm not good at it. I like to do things that I'm good at. I want to give you good care. And to your point, Ryder, I think it's perfect. Maybe that's even something you could acknowledge and say, look, if you thought that I was money hungry or something, this would be a perfect time for me to just say, yeah, okay, I'll do that because, it's bringing profit into the practice. But because I have your best interest in mind, I would prefer you go somewhere else to have it done so you get better care and then, come back here for other stuff, But, I like to tell them also, that I like to do the things that I know I'm good at. I know my limitations, and I'm not going to push myself beyond those limitations because I don't want to hurt somebody. I don't want to do something stupid and end up losing a tooth because I did something stupid or whatever.
Yeah, that's great. And knowing your limitations is actually more of a strength than like a weakness, I would say, especially in dentistry. Well, guys, let's go back, and we've been talking about, ideal patients. We've kind of agreed that there may not be a perfectly ideal patient, but when you have patients coming to your office, new patients, is it possible, do you think, to mold a patient's behavior into your ideal patient? And and how would you go about doing that? Marcus, how have you kind of handled these new patients in the past?
Well, I think from the beginning it's a good idea to we send out a welcome letter. I think that sets the stage for kind of what kind of practice we are, and that we're a welcoming type place, and that we're friendly. When they come in, I think it's important that you don't want to get overbearing with your policies and how you do things, but it's important that you let the patient know up front how your office runs. That you expect them to be on time, that you're going to run on time. That you'll go over their treatment options and financial options with them. That you expect them to give you a 48 hours notice or whatever your policy is going to be if they need to change their appointment. Just some of those kind of things. I think having some basic policies in place and sticking to them and making sure your patient understands what they are from the beginning is a good way to start off the relationship.
Yeah, that's great. I had a patient one time that we have them update their health history, usually when they come in for their recalls, just kind of go over things and change anything. And had one lady that came in and she didn't want to update her health history. That was the simplest thing you can do. And, she wasn't going to do it. She just refused to do it. So I had to go in there and talk to her. She was being kind of rude to my hygienist. And I just explained to her that, we can't treat you unless you fill out this. We need to be updated on your health history so we don't put anything in your mouth that shouldn't be going in there that could affect you. And she finally grabbed it from me and said, fine, I'll fill that out. And then she said, kind of rethought it and what, I'm going to go somewhere else. And I just said, fine, that's fine. And those are the patients that you can't get them out of your office fast enough. Anyway, Troy, what have you guys done in your office to help kind of mold these patients' behaviors?
Yeah, I like to just kind of figure out, who they are, get to know them a little bit, small chat type thing, and then kind of get a feel for their prior dental experience. We have a form that asks, who your previous dentist was, and kind of if you've had any, experiences that you could share with us or whatever, blah, 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 about that stuff. And I find that a lot of people that were kind of disgruntled or whatever with their previous dentist find that the lack of communication is one of the main things. If they feel like their dentist didn't listen to them or didn't explain things well enough, why do I need root planing, or something along these lines, that if you communicate with people, usually they're pretty reasonable. They may not agree with you, but at least they're more reasonable to deal with, and you can usually get by some of the the hiccups that we run into with telling them bad news all the time.
Yeah, and that's pretty much what we do. Somebody asked me that yesterday, how do you feel giving people bad news all the time? And that's pretty much what we do, a lot of the time. Yeah, it is tough.
I don't know. Telling someone they have a cavity is never a good thing. At least I've never had a patient jump out of the chair screaming how excited they were when I told them they needed a filling or a crown.
No, it's usually if they think they need a root canal and they just needed a filling, then they might be kind of excited. It's more relief, I guess.
They might be a little happier there,
yeah.
Only slightly happier, though.
Yeah. Well, let's talk about that for a minute. This exam anxiety and the guilt we feel about diagnosing stuff. I don't know if there are other dentists that feel this way. I'm sure there are, but I know when I tell somebody that they've got a cavity, need a crown, things like that, I feel like I'm giving them the worst news in the world, and it's not by any means. Yeah. But don't you guys feel the same way, that you get some sort of guilt by telling them that they have a decayed tooth or need some scaling and root planing?
Yeah, I do.
I do too. I think most people in the healthcare field are more or less compassionate people. I mean, they want other people to be happy, and they're trying to help other people out. And I don't know, for me, it's every time I go to do an exam, I'm thinking, oh man, I hope there's no cavities. I hope there's no cavities. Even though that's my job, I need there to be cavities if I'm going to be able to produce anything significant out of my practice. I need there to be problems. But it's just that hard dynamic of knowing that I'm giving somebody bad news. I'm telling somebody something they absolutely don't want to hear, that's going to cost them money, and that's hard to get over. I don't know that I've ever gotten over it. And to be honest, in the 13 years I've been in practice, and And it's just a constant battle of just trying to get my mind set that, okay, it is what it is. I'm just going to tell them the facts, and the way they deal with it is the way they deal with it. But I'm not, just my nature, that's not the easiest thing for me to do.
No, I try to tell people that I just report the news, and I'm just like the messenger. Don't kill the messenger, because I'm just telling you have a cavity. I didn't create that cavity. But Troy, how do you handle this guilt that I think you have had also when telling people they've got, stuff that needs to be done?
Yeah, it's a weird dynamic, and it's not something I was really prepared for in dental school, because, you don't, in dental school, just a few years we practiced in school on a few patients here and there, it didn't feel like this. When I got out of school, you get anxiety by telling people. You look at a cracked tooth and you kind of go, oh man, I got to tell this person they need a crown, and that's going to cost some money. And I think some of it is personality, like the personality of the dentist. Sometimes I think in my situation, it's my self-limiting thoughts, that I believe that the patient is going to be either upset or, they'll say, I can't afford it or whatever. Even though that may not be the truth, because I don't know the financial status of the patient. I don't know that they're going to be disappointed. I have been shocked in the past sometimes when I have told person that they needed some treatment and they weren't happy about it, because I've never had anybody happy about it, but they weren't overly upset. But inside of me personally, I'm like a bundled mess. I'm like, oh, geez, this is horrible, and, dang, this patient needs a root canal, or how am I going to tell him this, And it's just like my own self-limiting behavior or whatever, and my own personal rules, I guess.
I think with some of those patients, like for me, I don't particularly like the patient, whether it's their attitude or for whatever reason. And so part of me is like, man, I don't want to tell them they got stuff, because that means they're going to have to come back and I'm going to have to see them again.
Yeah, that's true.
There you go. Right back to the unique challenges that we face.
That's totally true. And then on the other hand, there's the patients you really like. And then you don't want to tell them the bad news either.
Because you want them to still like you.
Yeah. And what? And I've had a few recently where I've told them, you need a couple of crowns. They're like, okay, yeah, I kind of figured that. And man, what a relief that is when they actually are like, yeah, I kind of expected that.
When that happens, you almost like, you just want to go give them a gift card.
I want to give them a hug.
I know, right?
Yeah, and I was thinking, for people that are listening, if, we're talking about this guilt that we feel when we're diagnosing, the most important thing is that, you can go home and sleep at night and know that you did a good job. And if you're being honest about their diagnoses and that, they have a DO on number 4 that needs to be done, well, if they, disagree, they get mad, whatever, at least you can go home and think, well, I told them I was honest about it. And, if they decide to do it, great. If they don't, then whatever. And, even the people that are great about it, you want to make sure you're honest with them also. And I know there are, dentists out there, but that aren't always honest about things, and you don't want to be one of those people. You don't want to go home and, lose sleep over thinking that you did something dishonest or, not in the patient's best interest. So that's something to definitely watch out for.
Yeah.
Absolutely. Honesty is key. And if you don't think patients know that you're honest or not, that's not true. I think that they can sense it. And it kind of goes back to what Marcus was talking about a little bit. I think part of the reason I am okay with feeling guilt with telling people stuff is because I won't tell them something unless they need it.
Right.
You know what I'm saying?
Yep, that's
because I don't want to tell them. You know what I'm saying? It's not like I am excited. Oh, yes, you need a crown. Maybe some dentists are excited about that. I don't know. I am kind of different that way. I'm like, I won't tell them stuff unless they absolutely need it, because I don't feel good about telling people bad news anyway.
Yeah. It's totally true.
Yeah.
So it's like, I guess it's a good thing that we have that feeling. I don't know.
Yeah, I think you're right, Troy. I think, feeling bad about giving people bad news is probably a good human trait. Yeah,
right.
I think so.
Yeah.
If we are human still.
Yeah, we might be cyborgs.
I've got that baboon heart. I'm not sure about that.
That is true.
Yes.
Well, let's move on and talk about the rest of the people in our office that really help us out, and that's the staff. But how have you guys noticed that the staff can help with helping to mold these patients into what we would consider our ideal? Geez, let me start that over. how can the staff help us mold these patients into what we could consider ideal? Marcus, how have you noticed that your staff can help you do that?
Well, I think it's important to take the time with your staff and work through a few different scenarios. Like how are we going to handle a patient that's upset when it's time for you to go over the treatment with them? If they've never really, if you don't really have that scripted and they've never sat down and role played it, then sometimes it's really going to be a roll of the dice. You don't know how it's going to turn out. But if you take the time to actually kind of script some of those things, as silly as that kind of sounds and as weird as it feels when you're role playing, it actually does help you so that when you do have a patient, you've already kind of played through that scenario a few different times and you kind of know how you're going to handle the patient. So I think scripting is a good way to help the staff to mold the patient's behavior.
Yeah, and I think with scripting, the more you practice it, the more natural it feels, because we've all done it and it feels weird at first. And they do have to kind of think on their feet like we do, but it is good to have like a base of things to go to when you are in that kind of a situation. Troy, what have you noticed with your staff that really helps you help them mold the patients into ideal patients?
Yeah, I think it's key, just as key as having us be people persons, or whatever you want to call
it. People are people.
You know what I'm saying?
That's a Depeche Mode song, I think.
Right, it is. Yeah. I like that song. The end of the last podcast, we talked a little bit about having the need for us to be good with interpersonal skills, interpersonal relationships. I think it's just as important you have the staff, surround your staff with people that can do that too, because if your hygienist and your front desk can't talk to people, you're going to struggle. They're going to butt heads like crazy, and especially if it's like the first call, you get a new patient calling into your front desk and they can't communicate well. Boy, I don't think it's going to go well. I don't care how good of a dentist you are. If they can't get past that front desk to get an appointment, you're in trouble. So I think your staff needs a lot of training to help them, with how to talk about, like you guys were saying, different scenarios and that kind of stuff. So if you making sure you have the right people in the place to be able to get people in your chair.
Yeah, I think, as long as they can support your office policies and things like that, I think it's great. And I think you guys are right on that it does take practice, and you do have to have the right people in place. And I think you're right, Troy, that when they do call on the phone, like that's their first impression with your office if they have nothing else. And if the person on the phone, I've called specialist office before and thought, ooh, I wouldn't want to go there if I was a patient, because of how they answer the phone, and that can make or break a patient coming in. And one week our front office girl was out and had to have one of our assistants work up front, and she came back to me one time. She was having a problem with a patient. I can't remember exactly what it was, but she said, "Man, I just really wish the front office girl was here, because, man, I just, really need her to handle this." And it made me realize, like, yeah, these guys are actually specialized in their areas. And, they go from the front office, and then you want them to come back with your assistant or your hygienist, and you want them to have a good experience then. That's all leading up to you coming in the room. You're like the, big guy coming on stage, and they're just like warming the patient up for you. And so they have to make you look good, I think.
Yeah, absolutely. I mean, you can only imagine. I've had that same thing. It's interesting you brought that up. When you're calling a specialist office to talk to the doctor or whatever about a patient, and the front desk is just like cranky bag, and you're just like, wow, I'm referring people to these guys. What kind of experience is my patient having to these people?
Yeah.
Yeah, my wife one weekend had a toothache. She ended up needing a root canal on 14, I think, and I called one of the specialists that I know does just an amazing job. And I talked to his front office, and she was like, "Oh gosh," I told her who I was. "Oh gosh, I don't know, maybe we can squeeze her in. I really don't know if we can get her in." And I'm thinking, I refer a ton of patients, and, I don't really expect like overly special treatment, but I don't want you to act like I'm putting you out. And so anyway, I made the appointment, and then I called one of the other specialists that I really like. He's about our age and a little bit younger, and I really like, and he's just a little farther away, so I don't refer to him as much, but I do a little bit. Called his office. His office was, "Oh my gosh, yes, the doctor would, he'd be just, happy to see her. Can she come today?" It was, around lunchtime. Maybe he was working through his lunch. I don't know. And man, it was like night and day. So I called back the other office and told them that, she's not going to be coming. And, I didn't really give a reason. I just said, we got her in somewhere else, because I wanted her to know that we got her in somewhere else. And anyway, that endodontist called me back later and asked what happened. And I explained to him that I didn't feel welcome when I called. I felt like I was putting your office out. And he was like kind of taken aback that he couldn't believe that, his front office had done that. So anyway, that's my long story about that.
That's a good one. I like it.
Yeah, thanks.
It's true. It happens every day. So
it does, yeah.
It's true.
All right, guys. Well, I'm gonna throw some questions at you here and some comments that patients make to us all the time, and let's tell our listeners how we would handle things like this. So, Troy, let's start with you first. And this is a big one. This is a habit that's tough to break. Can I make payments, and can you bill me? What do you say to a patient that says that?
What? I don't tell the patient this necessarily, but I'll just kind of tell the listeners that I don't believe in I don't want to be a bank. So I don't really want to be a situation where I am, kind of holding money for people. When I bought the practice that I'm in, they had it took a lot of cleaning up to do, and so we have decided, my business partner and I, we are not going to do that. And we will make arrangements with some people. Don't get me wrong. There are some people that we know that we've had practice for years and years and years. We know who they are. We know they'll pay. But we usually, in most circumstances, will not do that. So what I will say, absolutely, you can make payments. We have a care credit program that will acquire, that you can apply for, that you can get, 12 months interest free, and we can work it out. Kind of that thing. I kind of divert it and make it sound like it is a third party. It's not us. So I just kind of say, you bet, that's the perfect way we can do this. So I kind of punt it off, because I don't, like I say, I don't really want to be a bank in the majority of situations, especially when you have. And I had a situation where the lady had just got done telling me that she needed like 5 crowns. I mean, she had a lot of work, and she just got done telling me that she just defaulted on her house payment and she's going to lose her car. And so I'm kind of, and she says, "Can you take payments?" And I'm kind of like, "Oh, sister,
sister, it was your sister."
Yeah, no, it wasn't my sister. You should have not told me that, because I had a heart and I was almost right going, "Oh, sure, I can do that." But then I'm like, "Oh, she's not paying her house payment, she's not paying her car payment. Probably not a good financial
not going to pay me."
For me. Yeah, I mean, if any patients are listening out there, don't tell your dentist that stuff before you ask them if you can make payments.
Yeah, I've had people when I've told them that they can apply for care credit that they said, "Well, I won't qualify." And I thought, well, if they won't qualify for care credit, why should I accept they're basically giving them a loan to make payments to me? So it's crazy.
Right.
Absolutely right.
Marcus, what about you? How do you handle that situation?
Pretty similar to what Troy just said. I mean, I think it's good to say something like, I'm glad you asked that, and then just explain it to him. Yeah, we do have the ability to make payments, and and it is care credit or something like that. I've heard of offices where they do, do in-house billing, basically, where they'll be the bank, and I don't know. I personally just haven't felt comfortable with that, or felt that that's a situation I want to be in, and so I usually make sure that there's some outside financing options for them. Just trying to make the patient feel like you're trying to help them, I think, is one of the things that can smooth that over a little bit. So not so much that you, the dentist, are going to do that, but whoever you've assigned on your staff that handles those financial arrangements, you want it to be somebody who the patient feels like is being a problem solver, that's on their side, trying to help them find a way to pay for the treatment, whether that's care credit or through their bank or using their credit card or anything like that. But just trying to make them feel like you're on their side, trying to help them find a way to pay for the treatment they need.
Yeah, and I think you both make great points, Troy, that when you said that you do let some patients make payment arrangements through you, and they have a history with you, they make their payments each month. We do the same thing at my office, and
sure,
that's perfect. And Marcus, I think how you said that you have somebody up front that handles that all the time, that's their job to handle the payment arrangements, and then it takes you out of it. I think that is great, because it is tough, because people see us as the rich dentist and all the money's going to us, and if we take ourselves out of it and let somebody else handle it, it does make it quite a bit easier, I think.
Yeah.
Yep, absolutely. That's another reason why I like to use a third-party finance system, is because should there come an event they don't pay their payment to that person, there's really not. I mean, it kind of affects the dental office because future care could potentially be at risk. Because if they start going default on stuff, but if they're dealing with collections on there, they're dealing with a third-party system, and I don't have to be a part of that. I just let them deal with that, out of my office.
Yeah.
Okay, guys, so what happens when a patient comes in and you present them with a treatment plan, and then they say, why does this cost so much? Marcus, how do you handle that when they're asking why they have to pay so much to you?
Well, I remember somebody teaching me this, or I read it somewhere, but they said when a patient asks you a question like that, one of the first things to do is to just acknowledge that it's a good question, even if it's not. But it makes them feel like you're...
Now I'm learning something here. Hold on. I got to make a note. Go ahead.
So you basically just say, that's a great question. I'm glad you asked that. Let me help you there. And so maybe their point, the person who taught me that said that just kind of diffuses the question, makes them feel like that you're actually, what they asked was important and that you're willing to try to answer it. But usually my response is, something to try to build the quality of what we're doing, rather than just saying, well, it costs so much because, freak, I went to dental school and I got $250,000 in loans, and all those are true facts, but the patient usually probably isn't going to really care or even listen to that. So I try to build in the value of what we're doing. So when they say, why does it cost so much, then say something like, well, we use the highest quality materials, I have the best trained staff, that kind of thing, that you're kind of reshifting it back to we're the best out there. We're using the highest quality. We've got the best stuff. And that's why, therefore, it costs what it does. Not that works for everybody, but I think it is one way to approach it.
Yeah, that's great. Troy, what about you? When they ask you, why does this cost so much? Why does your left-handed dentistry cost so much?
I know, because I'm special. Southpaws are always going to cost more. I mean, you just get better care.
That's what Rocky says.
I do get, I do the same thing that Marcus does and talks, I talk about that kind of stuff. I have, in some respects, when I do know the patient pretty well, explained to them, look, it didn't cost $5 to go to dental school. It cost me a fortune. And, unfortunately, that's the way it is, that in order to make things meet, there has to be a certain price. I kind of give them some basic economics, It's just like in anything else. I got to cover costs. I've got to make a profit, and that's the way it is. And I'm pretty straight up with people. I don't really sugarcoat it. The good thing is my fees, I don't feel, are outrageously high. I mean, for the area I'm in and everything like that, we're comparable and that kind of stuff. So it's not like they can walk down the street and get a less cost for something. But people got to realize that part of the reason, and this is a problem not only in dentistry, this is a problem with everything, in medicine specifically. The reason medicine is so stinking expensive, look at the cost it takes you to get into practice.
Yeah.
Of course, this is not something you can actually have time really to sit down with a patient, maybe unless you know them really well. But we're paying a fortune for dental school. We pay a fortune to buy a dental practice, and it costs a fortune to run it. So, I mean, what do you expect? You can't do it for free. It's just it can't be done. And if you don't charge enough, you're still not going to be in practice. So you have to be very careful and watch that line, especially when insurance companies are paying us less and less. Like, if you have questions about that, we have a podcast about insurance and how it's changing dentistry. So I can go into some of that detail with patients, depending on who they are, how well I know them. But, it is what it is. You always get that patient that'll say, oh, yeah, you're just trying to make a boat payment, or you're just trying to make a Lexus payment. Oh, I own part of this building by now, don't I? Or something like that. And Ryder, I love the way that you always say you respond to that. Do you remember what you say when the patient says that to you?
Well, I say I don't have a boat. And I also can't swim, so I don't go out on any open water anyway. Is there something else I say that I'm...
Yeah, you were just saying, trust me, your $800 crown does not just cover any part of this faults or something along those lines.
Yeah, I mean...
It doesn't make a dent in my college education for my children.
Yeah, for my kids. Yeah, I just paid for a semester of your college. Well, they're not, unless they're going to like college at my house, that doesn't, that's not going to cover it. So, yeah, sorry, I forget my own quotes.
I'm quoting you now.
Thank you. I've been quoted on a podcast.
Very famous dentist.
That's right. I run a very successful, very famous podcast with two other very successful and very famous dentists.
There you go.
All right, let's go on to our next one that patients say quite a bit. Marks, I'm going to start with you. When they say nothing hurts, so how could I have a cavity, or how could I have periodontal disease, things like that? How do you handle that?
I usually just say, you know what, you caught me. I was just making it up. No, I don't say that, but it's hard because like a patient doesn't necessarily have the same knowledge that we have, so you can't just start saying, well, that carious lesion started to, it's starting to grow into the dentin, and so sometimes it's good to just sit them up, have them look at the X-ray. I mean, even though they can't read an X-ray, you can kind of point out that, there's this spot. Look at your other teeth in that X-ray. The rest of them have this nice smooth curve that comes around. That one, there's this dark spot that's growing into the middle of your tooth. And also just to be upfront with them that a lot of this stuff doesn't hurt until it's so big that it is into like the middle of your tooth and where the nerve is. So I don't know. I don't know that I have a great answer. There's probably a better way to handle that one, but that one, that's kind of what I do.
Troy, what about you?
Actually, Marcus, I don't know if there is a better way. I think explaining to the patient exactly like you do is the best way. At least that's what I've found. Specifically with periodontal disease, because periodontal disease doesn't hurt.
Yeah, it usually doesn't.
And, nobody knows they have it. So if you sit them up in the chair, you show them the X-ray and say, look, this is where your bone is. This is where it should be. See these little spicules of white stuff sticking out the side of your teeth? That's tartar. That shouldn't be there, and kind of explain to them that stuff. Say, I'm not making this stuff up. And that proves right there that you're not making it up. It's not like you went in the back and photoshopped in a bunch of tartar on their X-ray, unless you're a really dishonest guy, which I don't know of any dentist that does that, goes to that extent.
Wow, yeah.
But you know what I'm saying?
Yeah.
I think that's exactly what you have to do because, like I say, even a cavity into your dentin just a little bit isn't gonna bother you.
And I think
necessarily.
Intraoral pictures, like with an intraoral camera, is another way to help
great.
explain that.
Yep, absolutely.
Yeah, those are great. And I've used the line that high blood pressure doesn't really hurt either until you have like a stroke. So then you're dead and it doesn't matter. But and like you guys said, intraoral camera pictures, those are great. Perio charts showing them pocket depths, things like that. And if people are having they complain about bleeding gums and things like that. It doesn't hurt. My gums just bleed a lot. Well, that's not normal. And, if you scratch your skin, you don't just like automatically bleed. But if you have something wrong with your skin and you scratch it, well, you do bleed. And you could scratch your gums pretty good and they're not going to bleed either. But if you're just simply flossing and your gums are bleeding, then something is definitely wrong.
Yeah.
We have some charts as well. You guys probably do at your offices where you can show the different stages of periodontal disease and kind of, I think not everybody, but a lot of people are visual learners. And so if you show them something, or put in more of the senses of, what it feels like, smells like, tastes like, whatever, that kind of stuff, the more that then they'll kind of understand it. So if you explain things to a person who's visual, and show them a chart, they're going to get it, Some people just have to hear you explain it and whatever. They just have to hear it, to pick it up. So it just kind of depends on how that person learns and the best way you can get across to them.
Yeah, and that goes back to you at first, Troy, when you said you kind of chat with the patient at first. It does help to get to know the personality of the patients and how to communicate with them. I know there's some patients I have, they want me to come in, sit down, do the exam, and no small talk at all, which I'm fine with. And and it's fine. It's not uncomfortable. They've been coming to me for years. They just don't need all of that. They just want to know if anything's wrong, and I'll fix it, or they can come back in 6 months. And so it is great to get to know your patients' personalities.
That's a good point, Ryder, because that's the thing about knowing your patient, having this, as we're talking about dentist-patient relationship. If you know the patient, they don't want a small talk, then you don't have to, and they're going to feel totally good with that. They're going to be fine. They're going to come back and see you. On the other hand, if you don't know them very well and they're like, they don't want you to talk to them, and you could potentially turn that patient off and they can go somewhere else. So you have to know the people. You have to know what they're like. And the difficulty of being a dentist is the patient you just saw in the chair doesn't care if you hit them across the head with a sledgehammer. They aren't going to be mad. They're going to be fine. The next patient, if you touch them or talk to them wrong, then they're going to go through the roof. You know what I'm saying?
Yeah.
It's like, and we do that how many times a day? How many patients do we see? 15, 20 people a day? So you're bouncing these emotions through this huge grade of people all day long. Yeah, well, it is emotional. That's an emotion. Yes. You know what I'm saying? It's like you have to just shift gears to different people every time you sit in a chair, because every single patient is different.
Yep, totally true. Yeah.
That's crazy.
Yeah, and I think the front office, whoever works in your front office, whoever takes the phone calls at first is it's important for them to be able to kind of pick out these personalities. They can usually tell on the phone what kind of patient this is going to be, and when they come in to fill out paperwork, them just kind of getting to know them and everything can kind of help give you a head start on how to communicate with the patient. All right, guys, let's talk about one more here. Troy, I'm going to start with you. When the patient says, "I'll just wait until it hurts to fix it," if they have a little cavity or whatever, how do you handle it when they say something like that?
Well, to be honest, that's the patient's choice. Of course, we learned in all of our risk management seminars that we have to diagnose and have to inform the patient, but whether or not they follow through with treatment is completely up to them. And that's very difficult because as dentists, we always want to fix everything. So what we do in that respect is I would explain to the patient what the consequences of their actions will be. And then if they continue to say that, then I go, okay, fine. Here, will you please sign this form that shows that I had talked to you about this and that you've decided to not do the treatment at this time. It's called informed refusal. So it allows them to say that they know about the condition and they're aware of it, but they don't want to treat it. That way, I don't feel great about it because I know it's going to, get worse. But at least that time I know that the patient understands and they can't come back on me and hold me liable for something that I say, and then they tell me that I didn't didn't tell them about it.
Yeah, that's great. Yeah. Marcus, what about you? How do you handle it when they just want to wait until it hurts?
I tell them that's even better because then I'm going to get to do a crown. That's going to help me pay for that vacation.
Maybe even a root canal.
Yes. Yes. No, like Troy said, ultimately the patient can decide. I really do try to stress to them that, you can choose to do that, but it's possible that when that finally does break or starts to hurt, it'll be at an inconvenient time for you, and maybe even an inconvenient time for me that I won't be able to take care of you.
That's a good point too, to bring that up. Yep, it might be on Christmas Eve.
It might be.
Yeah.
And I know you're joking about the whole, I get to do a crown and maybe a root canal and everything like that, but a lot of people do react to money, and if they do know that it's going to be more expensive the longer they wait, well, that might get them in to pay $50 for a filling rather than like $1,000 for a root canal and crown. So money talks.
Yeah,
yes, it does.
Explain it to them that way as well. The financial repercussions aren't as great either if you wait.
Yeah, it's totally true. If you got a flat tire in your car, it'd be better to go fix that than to drive around with a flat tire and ruin your rims and whatever else, I guess.
I can still get down the road, so why should I?
Get there. Still chew my food, I don't know. All right, well, what if I told you guys that I completely hate you, I can't stand you, I don't even want to be around you guys, but it's really nothing personal? How do you guys handle that?
Feelings mutual.
Yeah, that's what I thought. And that's the end of the show.
Yeah. I actually have joked around with patients and said that before. They're kind of taken back by it.
But it does lighten the mood, probably.
Make them think
it lightens the mood a little bit.
Yeah.
At least in you have to be careful you say it too. You could really offend somebody there.
Yeah, you're totally right.
No, go ahead.
You're fine. Go ahead.
I was just going to say, you do try to let it roll off and just be like, whatever. I've heard that 100 times.
Yeah,
but
today.
It can be a tough one. I mean, it can be over a long enough period of time, depending on the day. I mean, somebody says that, it doesn't always feel the best.
No, it doesn't. Troy, you sent us an article today talking about the higher suicide rates of dentists than of other professions. And, we've talked about this on some previous podcasts, that it does kind of build up over time by having people say they hate you so much. And it is tough. And we realize they're not saying that, they usually have the caveat that it's nothing personal, but we are dentists. So if they hate dentists, they do hate us. And it does, it does wear on you a little bit.
I know. It does, because I was just thinking about this today, and we talked a little bit about it earlier today. How many other professionals hear that all the time? Maybe medical doctors, maybe, I don't know. But I would really doubt that they walk in and say that they hate them like they do in dentistry. Dentistry, there is this crazy thing where people really do dislike dentistry a lot, and that's okay. I mean, it's just them being honest. But I do find it interesting that that it adds a crazy stress to your life after you hear it. We've heard it every single day, all day long for 13 years now, and I mean, like your accountant. Do you walk into your accountant's office and say, "Hey, before we get started, I just want to let you know I hate you." Okay, now let's talk.
And I want you to do the best work possible for me.
Yeah.
After you tell your accountant that.
That's the weirdest thing. And then they lay back and they open their mouth and let you the work on them. You're like going, "You just told me you hated me. Why are you even here?" But I don't know. Other professions, do they walk in? Your refrigerator repairman comes in and says, "Hey, just a second before we start. I hate you. I don't hate what you do." And I don't hate.
Don't
you
take this personal.
Yeah, I don't take this personally. I don't hate you. I just hate everything that you do.
Okay.
So basically, you hate me. All right. It's very strange. I don't know. I think it's unique to dentistry. I don't know of many other places that would say that. I mean,
no. People say how much they hate attorneys and lawyers and everything like that. But
maybe.
Do
they vocalize it?
But
I don't think they walk into your attorney's office
that's
and say,
exactly it. Yeah, you go into the attorney's office, you wouldn't say, "I hate you." You're there to have them help you with a problem, with a lawsuit, with writing a will for you or something like that. You would never say that. You might make fun of them after, but you would never say that to their face. They'd probably sue you if you did.
Yep, exactly. I think that's unique to dentistry because they actually vocalize it. You may say it in your heart or something or in your mind to somebody else, but they vocalize it all the time.
Yeah, they do.
Yeah.
Yeah.
And then, "Hey, doc, make sure you do perfect work because it's got to last forever and it can't."
It happens more than you think. You're totally right, guys. Well, guys, do you guys have any closing thoughts before we wrap up our show and talk about our exciting book giveaway and some practice opportunities, things like that? You guys have anything else you want to add before we move on?
No, let's get to the fun stuff.
All right.
Yeah, that stuff's fun. Let's get to the giveaway.
Well, we're going to be giving away a copy of our book, So You Want to Be a Dentist, and all you have to do to enter is leave us a review on iTunes and, tell us what you like about the show. We prefer 5 stars, but, we also appreciate honesty. So, go to iTunes, actually pause the podcast right now and go write us a review, and then we'll be waiting for you when you come back. And now you've written that review, and we're back for more. And so we just really appreciate all of our listeners and really appreciate, you tuning in and downloading us and everything. So, and Marcus is going to tell you a little bit about some practice opportunities that we have that are exciting, that have come up, that we've become aware of. And so, Marcus, why don't you tell everybody about that?
Yeah, so we've got some really, really cool stuff we're working on. We realize that for new guys coming out of school or people that have been out just a little while or pretty much anybody, if you're looking to get into practice ownership, it can be a little bit tough in today's environment because, banks aren't quite as readily willing to loan the money. Sometimes it's hard to find that practice. If you haven't been in practice ownership before, sometimes it's nice to make a little transition. So we've got a few unique opportunities in the Western U.S., and we're coming up with more all the time. In a variety of locations, a variety of states, where basically you can come in, get started practicing. We'll support you with practice management help and clinical help if you need it. And you're able to just get started, get practicing, and make some money. Over the course of working together, you can get into practice ownership in a relatively short amount of time. And it's a way to get into it without having to come up with a bank loan. And we've got a really unique way of going about it that we've come up with. So we're really excited about it. It's a way that we can really give back and help other people out there to get into practice ownership and do it in a way that's manageable and reasonable. And we'd love to hear from you if you're looking for a practice in the Western U.S. We'd be really flattered if you'd give us some contact through our email. dentalrealist@gmail.com is probably one of the best ways to reach out to us, and we can give you a lot more details on the opportunities and how it would work.
Awesome. Thanks, Marcus. Troy, why don't you tell everybody where they can get in contact with us if they do want to have any questions for us, if they want to talk about these practice opportunities, anything else? Why don't you tell everybody?
Yeah, you can find us at Twitter at Dental Realist. Like Marcus said, probably the best way to get in touch with us would be dentalrealist@gmail.com. And we're also on Facebook, so give us a shout out there and just search for Dental Realist, and we'd like to hear from you there as well. And then you can find our books. We have 2 books out. So You Want to Be a Dentist, What You Must Know If You Want to Succeed in Dentistry. That one's in print format, available on Amazon, iBookstore, Lulu.com. And then we have an ebook that is available on those platforms. So Now You're a Dentist, 30 Things You Must Do to Be Successful. So you can check those out, like I say, Amazon, iBooks, Lulu. Those are some places you can get a hold of us. We'd love to hear from you.
Yeah, definitely. Yeah. Go leave us a review on iTunes, and we just really appreciate everybody listening. And let us tell you that we love you. Even if everybody else hates us, we are here for you. We are the Dental Realist podcast that is here to support you. So we appreciate you listening, and we will look forward to talking to you on episode 10. Thanks for tuning in.